Denise. How you doing? So, I just came here for an update on my surgery. So, the surgery is confirmed for January 4th. Uh, his switch, I was going to be the first person to have the surgery that day, and I'm going to be, the last person to have the surgery like that day because he said that my surgery is going to take a little longer. He said around 4 hours because he has to first, take the band out and then afterwards, do the surgery. So that's going to take longer. Um, so I came to the office to talk to him, and I was like, decided like I want to have the gastric bypass, and that's it. So, but talking to him, he still convinces me that he prefers the sleeve. Um, and there are two reasons why he prefers the sleeve. So, a first reason, most important of him, it's that in the long run, it's less risk. There's less risk in long term compared to the gastric bypass. So that's one of the things. And he said that, you feel like more normal anatomy, you don't have the malabsorption. And I said, well, what about the weight loss? And he said, the, studies show that a lot of the gastric bypass people lose a little more weight compared to the sleeve, but that varies based on studies. That varies from surgeon to surgeon. So depending on how the surgeon performs the sleeve, the weight loss is the same. And according to him, that's his experience. He has like the chart of the average weight loss, you know, nationwide about the both surgeries and then compared to his experience of his patients. So he said that his patients used tend to lose the same amount of weight. So if it's comparing about weight loss, it's the same thing. But the reason why we still don't know what surgery we're going to have is because he said that I have the band, and the band has been there for about 4 years, and there's scarring. It's in the tissue of the stomach. So not only the band is around the esophagus, but also the stomach is stitched over the the band, so the band won't slip. So there's scarring tissue all over that area. It's exactly what he said where he performs the sleeve. So what we decided was that we're going to go into surgery aiming for the sleeve. If he gets there and he removes the band and he realizes that it's too much scarring, that's going to be a problem for him to perform like a good, a safe sleeve that is not going to leak and it's going to do its job. And also then he's going to go in and perform the gastric bypass. So, and he says, are you comfortable with both? I said, well, yes. uh, I am. I honestly, like, I am also divided between both. Uh, the sleeve I would prefer based on, I want to just have a more normal functioning of my GI system. Um, but with the gastric bypass, you also have, not only a little more weight loss, not according to him, but there's the studies about the gastric bypass and diabetes and all that, and I'm just like, oh, okay. Anyway, so I'm trusting. What I decided to do is I'm leaving in the hands of God. That's what I can do, because throughout my life, in big decisions in my life, I trust that the right one is going to be made based on what's better for me. And usually, till now, all the big major decisions in my life had happened in a fashion where it's the best for me, and it has to be what it has to be. So I'm not going to push to have a gastric bypass if maybe that's not the best for me. Who am I to know that much compared to the doctor? I know that I know a lot, but still. So anyway, so I'm praying that whatever is the best surgery that's going to happen, the surgeon's going to get there. He's going to take a look. If he thinks everything is fine, that's the sleeve. If he thinks there's something wrong, I'm going to believe that that's God's hand to say, well, um, that's better for her to have the gastric bypass, and that's it. So it's in the hands of God. So that's that. So my surgery is going to be on Monday, January 4th. He said that I was scheduled to be the first person to have the surgery. He switched me to the last person for the day because it might take a little too long due to all these, taking, it's basically two surgeries kind of in one. So it's going to take longer. And other than that, I mean, everything's fine. Health-wise, I'm doing okay. I mean, the weight loss is still a struggle, especially with Christmas and Thanksgiving. So I saw my doctor first when he told me to lose 10 pounds. I saw him in the beginning of November. So that was before Thanksgiving. And then there's Christmas. I saw him like a couple of days before Christmas, and he told me like, oh, you should wait. They want you to lose about 10 pounds until, in 2 weeks. I'm like, that's not going to happen, especially with Christmas. You can't tell me that. And then he's laughing. He said, well, I can't tell you that it's okay if you don't lose weight. It's better if you do. I said, I know. But, it's a slow process. I don't know what's happened with my weight this time. It's really slow. It's really been hard, and I've been, I'm behaving well. Let's put it this way. Once in a while, I eat something that I want to eat, but normally I'm eating vegetables and fruits and stuff. So I don't know. It is what it is. So anyway, I will try to come back. I don't know when I'm going to make another video. If not, like a couple of days before surgery, a couple of days after surgery. But I'll definitely keep you guys posted. And please join me in the prayers that, the surgery, it's going to be the one that's best for me. I don't know which one, I'm going to have. So it's a little weird to go into surgery not being 100% sure, but I trust this surgeon. He's really good, and I am comfortable with both surgeries. I'm confident that both surgeries are really good, based on your guys' experiences, my research on the matter. So anyway, that's that. So guys, thank you for watching, and I will come back as soon as I can. Bye.